Today we are welcoming Dr. Lauren Natbony. She is the medical director and founder of Integrative Headache Medicine of New York, and we're going to be talking about taking a holistic approach to migraine management. So one of the things that you talk about is the importance of telling the truth about migraine. What do you mean when you say that?
I'd say I love this question because I feel like that's kind of my mission, like to say it as it is and to say the truth. I think the way I view it as migraine is a disease. It is not a headache, obviously, as we all know, but always looking for the root cause. Everyone's always saying, we need to find the root cause. We need to find the root cause. I just want to scream and say, it's migraine. It's a disease. Will we say that if it's type 1 diabetes or if you have any other chronic illness? And I want to speak the truth of what it is to have migraine, what it means, how it's a genetic neurobiological condition, and that it is not headache, like that is not migraine, and talking about how tough it is to live with it, right? How much it actually sucks, and bringing truth instead of hiding behind what we think are like platitudes of what people want to hear, because it sucks and it's okay to admit that.
Absolutely. I totally agree with that. And, you know, one of the projects that we do during MHAM, which is Migraine Headache Awareness Month in June, is talking about migraine behind the mask. So that is our project. We have a lot of people who participate in that every single year. And so just encourage everybody to be on our social media channels and share those photographs and the comments that we have from those posts, because sharing the truth about migraine is so important. There's so much misinformation and untruth going out there. So I love that. You know, I love that you talk about that as well.
The amount of misinformation, so
it's crazy. It really is crazy. So let's talk about having a holistic approach to migraine. Not really quite sure if that's the same as having an integrative approach. I know people kind of sometimes use these terms, you know, they kind of switch them around, but why is it important to have that holistic approach, and what is meant by that?
Yeah, excellent question too, because the terms are all thrown around.
Right.
I don't like holistic, I think of as whole person, but not necessarily evidence-based. Like you can be a whole person approach, but how are you doing that? So I think when I term it, like the complementary and integrative medicine is more the accepted evidence-based term. So I take from that integrative medicine is integrating all aspects of someone's life and care. So it's not only the physical, but it's the social, the emotional, the impacts of not only the person, but also society's influence on the person, but really looking at all things that go into making someone who they are. So, and holistic through an evidence base. So everything I do and everything I talk about is based on scientific evidence. So I will always caveat by saying, if there's no evidence, there's no evidence, but what I'm recommending is scientific. Just because it's not pharmaceutical or medication doesn't mean it doesn't have evidence.
Right, absolutely. And that's really good. And in many ways, it's talking about migraine treatment as a toolbox. So you're looking at everything all together. And again, just to affirm what you said, that there is so much stuff out there that's recommended that there is no scientific evidence for. And just because somebody has lots of reviews on their website doesn't mean that something works. We need to have that scientific evidence. It's so important. Why do you think that there was so much emphasis on a quick fix with medication? It's kind of like, I always call it a one pill and done. You know, you're in, you're out, you're just going to treat it that way. And what are the consequences of approaching migraine treatment like that?
I just think look at society. Everything is a quick fix. Everything is how can I get the best for the littlest amount of effort just to do it quickly? And I always say, if I had the magic pill, you think I would hold it from you? I'm like, please take the magic pill. Like that would be wonderful. But quick fixes for some things, fine. But for most things, it doesn't work. There isn't magic. And I feel like, again, it's society, but it's not reality. And I think that's the focus. So when patients come to me, they're like, I just want you to solve it. Just give me what to solve it. I'm like, if I could, I would. But I think I've said this before and lots of other speaking I've done. If migraine was only one neurotransmitter, only one chemical, or only one thing we can approach with one pill, fine. But we know it's not, and there's not that one pill for everybody. And that's also why looking at why do some people respond to a certain medication and why do others not? That's again, looking at the whole person profile. I might not have a scientific biologic answer, but there are reasons and attributes that we should be looking at to choose our treatment for each patient.
I love that. That's interesting. And slightly off topic, just going to make a comment that recently I was talking with a pharmaceutical company, and I was asking them, why do pharma keep coming up with oral medications to stop migraine attacks when they know that we throw up, or we have severe nausea, or we have gastroparesis? And the answer was because that's patient preference.
Yeah.
But patient preference is not necessarily the most important thing. What is the most important is effective management of this disease, right?
100%. I always take into account, you always want to go, what is the preference? But a lot of times patients have preference because they don't know the options.
Exactly.
Like, it's scary to do what you don't know. If I say, we're going to use an injection, we're going to use a nasal spray, but don't explain why we're doing that.
Right.
Why would anybody do that? I wouldn't do
Right.
that.
No,
And
why would they?
that's been the problem, is actually getting the education over gastroparesis, getting the education over, if you're nauseous, you should not be using an oral pill. But the education just falls short. It's just not really there.
Absolutely. Absolutely. And that's definitely something that we're working on, you know, especially with a new nasal spray coming out, with a nasal spray that came out a couple of years ago. I'm super, super excited about that because I know that oral meds really don't work for me during an attack. And personally, I believe that's why a lot of people end up in the emergency rooms.
I agree.
Right? Because they're inappropriately given that. So kind of moving on to some more detailed questions. Thank you for humoring me with that little comment. That's just kind of
great. It's true. It's a great comment.
Yeah.
And I actually had a patient I was talking about this with yesterday. I'm like, the reason why you're going to status migraine all the time is because we're treating with oral medication. We shouldn't be.
Right. Absolutely. Yeah. And that's tough. And I know a lot of people in our groups, they want a quick fix. We all do. You know, we see often that people say, just referring to your earlier comment, people want to know the root cause of migraine, what's really causing this, or what's my specific type of migraine, so I know for sure that this or that will treat it. And you know, I want to laugh, but I also want to cry because it's devastating. And I know that for myself. We wish that migraine was that simple, right? But it's not.
Oh, I know. I wish I could point on a scan and be like, there it is. It's right there. Because I actually think it'll be easier to accept, but it's not.
Yeah, absolutely. So let's talk about supplements, because that is a topic that we go over a lot. So what supplements do you most recommend for migraine, and rough doses of that, if there even is any good evidence for that?
Yeah, so the supplement with the most evidence is magnesium. And when we look at choosing a magnesium supplement, there are different formulations. I think this is where people get confused. Like, there's magnesium oxide, there's magnesium glycinate, there's magnesium maleate, there's all the different magnesium. So which one do you choose? To say they're probably all fine. There's probably not one that's 100% better, but when I choose one, I like to look at one that has good oral bioavailability. If we're taking an oral pill, we want something that's going to be absorbed well, right? So I tend to go for the magnesium glycinate, or one that's chelated, meaning it's bound to an amino acid, so it's absorbed better by our GI tract and doesn't give as many side effects like diarrhea. So the dosage wise, I would say glycinate, maleate. You can also do oxide. Like, again, it all should work relatively the same. It just depends on a little bit differences in absorption. Optimal dose of magnesium, really anywhere from 400 to 600 milligrams a day. It can have a little bit of a calming effect. So like if you have trouble sleeping, I would say like you can take it at night. It can be split during the day, but I love magnesium. I feel like it's really easy to use. It's good for mentally related migraine because we know that magnesium levels can be depleted in the brain, more so with menstrual migraine. So taking it around that time is good. So magnesium, really, there's no one I would say, again, not no one, but really no one I could think of that wouldn't be a good candidate for magnesium. Other supplements, vitamin B2 probably is the next one that has great evidence. Riboflavin, not to be confused with vitamin B12, but vitamin B2. So it's a cofactor in our energy production. So it helps with our mitochondrial energy. And we think that that specific energy type is depleted with migraine. When we're supplementing with riboflavin, a lot of the supplements, like the combined B vitamins, have such low doses, you're not really getting enough. The optimal dose is 400 milligrams a day. And side effect wise, really not much. You can turn your urine like a highlighter yellow color, like literally looks like you're peeing a highlighter, but not dangerous. It's just the medication in your urine. So I think there are some people who are athletic and like, I need to know if I'm super hydrated. I can't know if I'm hydrated because of my urine. That's really the only way I can see that being an issue.
Right.
So for most people, magnesium, riboflavin, and coenzyme Q10. So I like coenzyme Q10, especially for kids. It has more evidence in pediatrics as well. It also helps improve the energy production of cells, which can be helpful for migraine. Recommended dose is 300 milligrams a day, and that could be all at a time. It could be 100 milligrams 3 times a day. I say whatever you're going to take. A lot of people aren't going to take something 3 times a day, but it's better taking with food that's higher in fat to help its absorption.
Interesting. Okay. Okay. What
I can
about
tell you
butterbur?
on.
Yes. No, I'd love to know more. Let's talk about butterbur and some of the other ones as well.
Sure. So I love butterbur, but butterbur, it's really, really, really important to get a purified version of butterbur, which is Petidolac. So Petidolac's brand from the Petidolac website, not Google Petidolac, because you want it to be purified. If it's not purified, it can have byproducts that can harm your liver. So a lot of times I'll see these supplements combined and it says proprietary butterbur. I don't, no idea what that means, no idea what's in it. And I would never want someone to put that in their body when it can be harmful. So butterbur Petidolac, the Petidolac butterbur at a dose of 75 milligrams twice a day has really good evidence for migraine reduction. I think that there's been a fear of using it because of older studies of possible liver issues, but none of the newer data has supported that. And when we look at efficacy, I feel like it's an easy way to get efficacy with no side effects, not being on a pharmaceutical preventative. And I think we need to sort of retake butterbur and Petidolac specifically as a great supplement, because it is, and I think it's underutilized. But I would say for that, like obviously discussing with your doctor, but I think that Petidolac should be used more widely, and I've started to use it more in my patients as well.
Okay, that's really good to know. And for some of those doses that you've given, those are adult doses. And we're going to talk more about children at the very end for those who are watching for their own children. Right. So what dose, are there specified doses for children? Are there recommend doses?
Yeah. So I have to honestly go back into all the different ones and look at the recommended doses. For Petidolac, I believe it's 50 twice a day. For magnesium, it's around 300 to 350. For vitamin B2, I believe it's around the same. I'd have to go back and double check. None of these vitamins are toxic. It's not like you can overdose on them, but kids sometimes need lesser amounts to have the same therapeutic effect.
Yeah, absolutely. That makes sense. What about some of the other ones like melatonin? Any benefit using high dose omega-3 versus omega-6, GABA, some of these other ones that may not be specifically for migraine, but I don't know, maybe they improve.
But they are, no, but there's, no, I feel like there are. So melatonin actually has evidence for migraine specifically. Melatonin is actually a terrible sleep aid. I feel like it's touted as helping you sleep, but melatonin was never meant to be used that way. It helps shift our sleep in phases, like if you're jet lagged or if you're trying to shift to go to beds at a different time, but it's not supposed to be used for making you tired. But it actually has been shown at a dose of 3 milligrams. So 3 milligrams, not 10 milligrams, not higher isn't better, but 3 milligrams can decrease the frequency and intensity of migraine. Actually, the reason we think it works is it's similar to a medication called indomethacin, which is an anti-inflammatory, which can help for many different headache conditions as well as migraine. But because it shares structural similarity, it can be helpful as a daily preventative supplement.
What about omega-3? So we had a specific question about that. Should people be raising omega-3 and lowering omega-6?
So for life, yeah, in general, I feel like for life, we should be. And we do know that type of diet, the Mediterranean, the higher omega-3, lower omega-6 is better for migraine. It's anti-inflammatory. The issue comes when people try to use supplements, because supplements are artificial. Like what are they actually, what is the ratio? And I think trying to incorporate it in a diet has had better outcomes, but all the studies, they weren't 100% clear on this is the exact amount. So I usually give patients a list, and I did social media posts about what's high in omega-3 and low in omega-6, and just say, try to incorporate more of these foods, and then maybe cutting down a little on foods that are high in omega-6, because I think it's obviously more challenging than just supplement.
Right, absolutely. And I see that we do have some new questions coming in. Just want to let you know, we're just going to talk about supplements for right now, but we have a lot of other topics we're going to get to, so don't worry. I am seeing your questions. We're going to be covering a lot. For those of you who missed the reference to proprietary blends, maybe we were just talking about that before we went live. Maybe you could talk about why it's a problem when bottles list proprietary blend.
What does that mean? I have no idea. Like if I Google proprietary blend, no one could even tell me what that means. Right. So you want transparency of ingredients.
Yes.
If it says proprietary blend of magnesium, that could have 1% magnesium and the rest sugar. Like I have no idea. So when you're looking for a supplement, being able to say, this is the ingredient, this is how much of the ingredient I'm getting, and know what those ingredients are themselves, separated out from whatever blend they're in. So I think transparency, really important. Also, we'll just go to, how do you pick a supplement?
Right.
Yeah, like sort of looking at the quality of the ingredients that are in it. If you have never heard of any of these ingredients, I would say, yeah, probably not your best choice. And then there is regulatory compliance. Like there are regulations, there should be, that go into supplements. So good manufacturing practices, like you have to adhere to quality standards, and different third-party testing sites. So I'm not saying that every third-party testing site is going to be the arbiter of what's best. But looking at like USP or like consumerlab.com, or looking at how supplements were tested, can give some information into their quality. I usually go for the ones that I know and trust, the different brands that I have used for a really, really long time. But each doctor might have their own. But I think just going and saying, I'm going to get that one on Amazon, doesn't necessarily mean you're getting what's in the bottle. So definitely doing your research and homework and asking your doctor. A lot of doctors might not know about different supplements. And I think that's where it gets tough, but we should know. but
Yes.
it's always hard. And I think just doing your research and also manufacturer reputation. Yeah,
definitely. I mean, there are definitely some manufacturers that, as an organization, we talk about, that I use. We're happy to put a list in the comments of the ones that we know are independently verified afterwards. But yeah, this would be one situation where on Amazon, more reviews, higher stars doesn't necessarily mean it's better at all. Please stay with the major brands. It may be more expensive, but at least you know what you're getting. And that's so important, especially when it comes to things like interaction. So moving on to our next question. I know that for myself, I use an app, drugs.com. I put all my medications, all my supplements into there. A lot of us have comorbidities. We take a lot of meds, a lot of supplements. So is that the best app that you would suggest? Is there another way that we can personally be on top of potential interactions?
Honestly, I love drugs.com. Like, I think it's fabulous. I use it too. Like, I feel like there's nothing necessarily that's better, because you can put in, they have all the supplements, medications, and then, yeah. But I would say always run it. Like, why not? Like, even sometimes there's food interactions, like food drug interactions that you don't even know about. Not things that are harmful per se, but I think there are things that we don't necessarily think about. Like, for example, magnesium and gabapentin, like they don't interact, but one changes the absorption of the other. So we want to separate them in time. And again, not going to hurt anyone, but maybe it's why something isn't working as well.
Right. Absolutely. And I know you talked a little bit about magnesium. You could take it at any time during the day, but it can also relax you. So maybe you should take it at night. Are there other supplements that you recommended out of the magnesium, the B2, CoQ, butterbur, melatonin, that should be separated out, or that should specifically be put together?
That's an excellent question. I think most of them can be put together. Obviously, I do melatonin at night. But for the other ones, I can't really think of any that would specifically be contraindicated at a certain time of the day. Obviously, if you're taking a ton of big pills at once, just thinking about, I always wish I could put it all into like one pill and just all the little ingredients.
I know.
But just being mindful of also just not overdoing it with supplements, because more isn't always better. It's the case, like, I think thinking that piling on 5 supplements is going to give you 5 times the results, not necessarily. So I don't tend to stack on every supplement at once. I tend to say, okay, if you have menstrually related migraine, if you have migraine with aura, I'm going to go with magnesium because it has the best evidence for that. If you, again, going with menstrually related migraine, vitamin E. I would never use vitamin E in someone who doesn't, like in a man with migraine, not using vitamin E. It's not going to have evidence. Vitamin D actually has evidence too. It does have anti-inflammatory properties and it has some analgesic effects. And we think that being deficient can play a role in migraine. But if someone is not deficient, I'm not going to load them up on vitamin D. So I think it really just depends on the person. So I say, if you're going to start any supplement, start magnesium, riboflavin, great, maybe some CoQ10, but then I really personalize it and try to say, what supplement does this patient need?
That makes a lot of sense. I know we also have a question here that just came in about managing vertigo. We can talk about that a little bit more later, but are there any supplements that you specifically would recommend for the vertigo aspect of migraine, or is there nothing that would be specific for that?
Not specific. I would still go with magnesium riboflavin.
Right. Okay, good to know. So let's talk about some alternative treatments. We're going to look at acupuncture, acupressure, mindfulness, meditation, dry needling, physical therapy. I'm sure I've missed some as well. Why don't we start with acupuncture, since you have training in that?
Let's do it. I love acupuncture. I think acupuncture is a great tool, but it's a tool, part of the toolbox. And I think the biggest downfall with acupuncture is unrealistic expectations and commitment. So doing acupuncture a couple times and saying it doesn't work, don't expect it to. All trials, we're doing it 10 sessions, once or twice a week for 8 to 10 weeks, and then looking at outcome. And outcome, it's not huge gains. It might be small victories, but it's consistency of treatment. And the clinical trials, everyone has different acupuncture points. Like, it's very challenging to do any rigorous clinical trials when it's a point that you're saying go to, or it's based on the patient's symptoms and actually picking your own acupoints. So I think the clinical trials tell us only a little bit of the story because they are limited, but I think patients need to also buy into that it can work. It's kind of like, how could it work? You're putting needles into parts of the body. Well, if you look at the science and also the non-scientific part of it, there are channels, there are flows of energy, which is what we're taught in acupuncture, and you're basically balancing the flows of energy. But if you also look at it from a musculoskeletal standpoint, putting needles in areas of tight muscle can also be helpful in reducing tight muscle. So the way I practice it is a combination of both, with the dry needling into the tight muscles, trying to balance on the acupuncture points. But I was going back to evidence. There is evidence for episodic migraine. So evidence does exist for episodic migraine. There isn't great evidence for chronic migraine in terms of reduction in frequency, but there is good evidence for overall quality of life, because it helps with relaxation. It helps with acceptance, commitment. It basically just helps with the whole high sympathetic state, and to help it calm down, and patients find it relaxing. And overall, if you look at disability scores, they do go down with acupuncture. And just because something isn't reducing frequency, it can still be an improvement in the toolbox. Acute treatment, there is evidence that it could be helpful acutely, but no one's running. I'm going to run to my acupuncturist if I have it's not going to happen. So it's really not that practical. But I think looking at acupuncture as it is time intensive, it's also resource intensive. But for patients who are willing and able, I have never seen anyone who it didn't add to. It might not help a ton, but it could be that little bit that makes a difference.
Right, absolutely. And I know for myself that with some of these alternative treatments, for example, biofeedback, never had any pain reduction at all from biofeedback, but it helps me manage my anxiety about having migraine, right? And so it just all kind of fits together as part of that big jigsaw puzzle. Which
I'm
is
obsessed with
important,
biofeedback, not only for migraine, but I went to one of my colleagues in the other day to do biofeedback, and he hooked up the clip on my ear, and I'm looking at the screen and doing my breathing, and he's like, okay, try to breathe slower. Watch yourself go from the red zone to the green zone. And I was just I'm standing there, and I'm like, my mind is racing. I have a million things to do. And just looking at how I was able to calm down just by breathing slower, not even for pain, but just, I felt better. Is that really slow to say? I felt better in that moment. I was like, yes. It also gives you that locus of control, that there are things that you can do in that moment to control your response to them. And the autonomic nervous system, our parasympathetic, sympathetic, fight, flight, is all out of whack for multiple different reasons. But the fact that we have the power to rebalance that with what we can do, I feel like is hugely powerful and is underutilized.
No, absolutely. And if anyone's interested, personally, I use HeartMath. I use a program with them, which I love it. It's not super cheap, but you buy it, it's yours. There's also an app, Juva, which is still being worked on. They do have a year free trial for that. So you can go in and try it. Both of them have pros and cons, but for myself, I know it's very hard for me to stop and do it, because when I feel well, I want to go and catch up on everything, right? But when I do it, I feel so good.
No, I just made myself, when I said I'm starting I'm starting to do it myself, because I feel good when I do it. I'm like, I have to take the time to do it. And I feel like I always want to do everything that I'm telling my patients to do, but I found so much benefit there. So and I think a lot of patients also who are sensitive to screens, a lot of it does require screens, but actually there's a HeartMath one that doesn't. It's completely sensor based. So even for those of you that are light sensitive, it doesn't always have to be on a screen. Yeah,
definitely. I mean, one of the things I like about HeartMath is you have that option for no screen at all, which is fabulous. I'm very motivated by kind of games and achieving things. So the one that you use on your computer has lots of different variations. Some of them are really tough for people with migraine, but some of them are great. It's kind of a balloon that kind of goes up and flies over mountains, and I'm very motivated to get it to the end. So I'm learning how to relax. That may not be how other people are motivated, but it's good to have that tool, right? It's hard.
It's so hard. I'm just like, why is relaxing so hard?
Yes, it's hard to relax. It really is, but it's a great tool in your toolbox. Let's move on to mindfulness and meditation. What is the evidence for that, and should people be doing this?
There's really good evidence for mindfulness. There's been a lot of more recent studies. Some of my NYU colleagues have been doing a lot in the mindfulness space. I think mindfulness it's different from biofeedback. It's more being present moment, and again, trying to calm your nervous system. Yes. But it's another one that takes practice. And like, how do you do mindfulness? I'm still trying to figure that out for myself, because I honestly, like, you can say practice mindfulness. What does that mean? I don't know. But I feel like there are different apps, different classes. I think it's trying to put into everyday life these moments of taking a break from your everyday stressors and just coming back to being present. And there's just some evidence that group classes without just being more present in the moment can be helpful. So again, you don't have to like necessarily go, I'm going to practice mindfulness, but just trying to incorporate it more into life. And meditation, there's so many different types of meditation. So there's mindfulness based, and then there is, I can't do quiet meditation. It's just like, not just like, I can't
do that. It's not going to happen.
But I found guided meditation can be very, very relaxing. And progressive muscular relaxation, not necessarily meditation, but that's more of a mind body. I found that to be really helpful for pent up muscular tension. But all these modalities, again, have to be tried multiple times in order to know if they're going to be successful. And again, pain shouldn't be the only barometer. It should be overall feelings of like self-efficacy and feelings of less disability and more pleasure in day-to-day life. So I think we need to also focus on those outcomes.
So, and just to throw a few resources out for people, if you want to try the Juva app, they actually have a lot of guided meditations on there. Dr. Dawn Buse, who is fabulous, she has a really calming voice. She has a lot of meditations on that app, which are really, really good. One of the medical devices that are approved for migraine, they actually have a meditation you can do while you're using that device. And you can also go check out Miles for Migraine. They actually have some events regularly where they do things like mindfulness and meditation, some creative therapy and things like that. So I encourage you to check out Miles for Migraine. They're a fabulous organization and a lot of resources. I know there's a lot more out there, but that's just kind of off the top of my head to recommend people to try out. What about physical therapy? Is that beneficial for migraine? For me, I'm like, it always makes my neck worse, for example, which of course then triggers my migraine, but maybe I'm just doing the wrong exercises or seeing the wrong person.
So I think that physical therapy is one of those things where if you're not seeing someone who is trained in knowing what to do for migraine, I don't know what they're doing. So when I recommend physical therapy, when you write a script to doctor, it's like physical therapy. What does that mean? So when I recommend physical therapy, I only recommend the practitioners that I know that actually focus on stretching, strengthening, and overall changing the architecture of our posture, where our head is in space, and actually working on what needs to be worked for migraine. There are different theories. Me personally, I feel like stretching is not the only thing. If you're stretching, you're basically releasing in that moment. It's just going to come back. You need to strengthen the surrounding muscles. You need to work on exercising them, stretching them. Like there's much that goes into it. And I think it's different from other pain conditions. It's not a one size fits all, and it can be activating. So for some patients, physical therapy can be extremely activating and triggering. So working with someone who knows and who's also, you're doing the exercises at home. I think going to physical therapy once a week, so like it's just not going to be it. And so you need to make sure the physical therapist that you're working with is giving you exercises to do, asking, what are my goals? What am I doing? I think a lot of times we just do it and we follow, but what am I trying to achieve by what I'm doing? And saying, okay, how are we monitoring that progress? Because doing physical therapy, again, it's one of those where I don't really know what that means. There's some great physical therapists out there, and I'm happy to always share resources, but I think that finding those people or asking for those resources are better, and just doing physical therapy by
Right.
itself might not have as much value as I think people think it does.
Absolutely. And just in case people are wondering, I'm not sure if this has already been posted, but we are putting the link to Dr. Natbony's website in the comments. So please go check it out and check out her resources as well. I want to touch on something in this section for alternative treatments that we got a question about, and I kind of thought about it myself. So I was personally recommended to do cold plunging, not so much for migraine, but for fibro and an autoimmune disease I have. For me, anything cold is like, please don't let it anywhere near me. So I didn't do it. But the question is, would that help migraine? There is some theory that it reduces inflammation. Personally, I can't think of anything worse than doing a cold plunge. But what are your thoughts on that?
I'm thinking about all the research I know. So we know that like cold compression, like on the head, like with ice can be helpful to sort of bring down pain. But putting your whole body in a cold plunge, I feel like any shock to the system, when I think about migraine as it is, change and shock is never a good thing, like going from one extreme to the other. So I don't see, personally, I've done the cold plunge, I've done like the freezing chambers, and it's a shock to your system, but I don't really think that there's evidence there in terms of what is it doing to help. I think there are better solutions.
Better ways, right? Because the migraine brain doesn't like change.
Exactly.
So, why do that? But if it helps you, let us know. Yeah,
it's one of those things, like, even though it doesn't have evidence, if it works for you, amazing. It's not hurting anything. Like, by all means, I just can't say that there's evidence to support it.
Okay, good to know. We're going to go slightly, not off topic, but off the list of questions we previously had. We got a live question about water. How much water should we be drinking generally as people with migraine? And during an attack, especially like a bad attack, should we really be upping that water? I guess the theory is that if you go to the emergency room, you'll be given an IV, you'll be hydrated. Is there stuff that we should be doing at home? And does it help?
I think water is the biggest myth out there. Like, it's not as big of a deal as we all think. Like, being dehydrated, sure, can be a trigger, but there's really been no amazing link to actually drinking more and more water as being preventative. We should all aim just for overall life of drinking like 60 to 80 ounces of water a day, and extra 8 ounces for every cup of caffeine, more if you're exercising. But there's been no great evidence that says if I do that every day, it's preventing migraine. There's one study showing the benefit of hydration, but yet that seems to be all anyone can talk about. I think the reason you get IV fluids is dehydration from vomiting, nausea when you have a gastric stasis. Like, also drinking water and getting IV fluids are different. IV fluids go intracellularly, so actually rehydrate you, because it doesn't just have water. It has electrolytes. It has other substances that are repleting intravascular volume loss, whereas just drinking a ton of water might not have that same effect. So it's not going to hurt to drink a ton of water, but I think we have to start forgiving ourselves if we're not. And just saying, you know what, water really probably has the least evidence of everything.
Interesting.
Stay hydrated, because being hydrated is important, but if you can't, it's okay. Like, who wants to be there with a killer migraine, feeling you're gonna throw up and having to chug a ton of water? Like, that's just not happening, and it's not practical, and it's probably not helpful.
Right, that's good to know. And just going back to like the science-based evidence, it's really important. People, myself in the past also, we'll look at the studies like, oh, this study proves that, and this study proves that. But studies need to be repeatable. They need to be peer reviewed. They need to have a reasonable number of people in them. And I know there's a lot more to it than that, but those are the three things I'm thinking of, off the top of my head. You can't just cite one clinical study that may not even be clinical study or double blind or anything else, right?
A lot of it is case reports. There's a ton of and also to point out the difference between causation and correlation, because just because something is correlated doesn't mean it's causal. Like, you might be dehydrated and you might have migraine. It doesn't mean that they have anything to do with each other. And I think when reading studies, unless you've been reading them really consistently and understand how to extract the data, it's easy to make associations that aren't necessarily there.
Right. Absolutely. Yeah. And we talk about correlation versus causation all the time. And that's really hard, especially when someone's taken a new medication. Yeah. It's like, did this cause this side effect? Did it cause that side effect? Did it stop a migraine? Did it trigger it? Migraine's so complex that it's sometimes just impossible to know, except for maybe over a period of time. And if you get enough reports about it, then that's helpful. But it can be challenging for sure, right?
100%.
All right. Let's talk about the gut. So we know that there is a gut-brain connection. I think all of us know that in theory. Some of us struggle with that more than others, and partly maybe because we crave certain foods during attacks. I know a lot of us crave carbs. We need it, and then we feel guilty. We're putting the wrong thing in our gut, or we're not eating correctly. And then we live with a lot of guilt and shame because we feel like this is causing, I'm going to use that word, causing a migraine, which it isn't necessarily causing the migraine. So how important do you think it is to monitor the gut, what we're putting into it, and how much does that impact migraine?
This has been a more recent hot topic of sort of overall gut health, the microbiome. I think we still have a lot more to learn about it, but we've always known of the gut-brain axis and that there's a connection. The vagus nerve, we're nauseous, we're vomiting, and we know that having like IBS or like functional dyspepsia or any really GI disturbances can impact migraine. But we still don't really know like the food and what you're eating, and is that disrupting the microbiome? That's still way out there, and is changing what we're eating, fixing whatever problem is there. I know there's all the theories of leaky gut and all that's out there. What I would say is right now we know there's probably a correlation. It's not necessarily a causation, but one of those things where I say it's never harmful to eat healthier and to eat things that are more anti-inflammatory and gut healthy. So if you're making a choice and you're able to make a conscious choice between eating something that is natural from the earth, that is not going to disrupt the gut balance, do it. But I wouldn't hedge all bets right now on changing your diet so drastically that that's going to be the cure all. So I think it could be a tool. I can't say 100% how much, but I go with my patients and I say, why don't we try an anti-inflammatory diet? It's hard to do. Why don't we try to do things, for example, even healing the gut NSAIDs. Taking a ton of NSAIDs is going to destroy the acid balance in your gut, going to destroy the ability to uptake different vitamins, and dealing with also just those little intricacies of what patients are taking. How might a medication be changing the microbiome, what we can do to overcome that, I think is an important conversation to have. But it's not necessarily a one size, like most things, not a one size fits all.
And not every diet is good for everybody. A keto diet may not be best for you if you've had your gallbladder out, for example, or for other conditions, right?
100%. Yep. And I think just saying like the ketogenic diet, which has some evidence, I'm never going to recommend the ketogenic diet for certain patients. I'm never going to recommend, like it just is very independent. And just because it has evidence doesn't mean it's going to work for that person or be sustainable. Like think about it. Like just because you have this thought, I'm going to go on this diet, it's hard. And if there isn't great evidence, like really limiting what you're eating, I don't want to subject someone to that unless I can say this is going to be beneficial. If they're open to it and they want to do it, absolutely. But I think everything has the minuses.
Absolutely. Now, you did mention the Mediterranean diet. So the Mediterranean diet being one of the anti-inflammatory diets, would that be one of the ones that if someone wanted to try something, you might suggest to them?
Yeah, so I would say the Mediterranean diet because it's more of the high omega-3, low omega-6. If you look at like all the diets out there and the studies that have been done on migraine, the best evidence is for high omega-3, low omega-6 type diet for patients who don't have any comorbidities. Like there are different diets I might recommend based on comorbidities, but that's sort of the general safe bet. So that goes more with the Mediterranean diet.
Okay, that's good to know. And just a resource for people in case they want it, the Dizzy Cook. We don't have any financial relationship to this, but Dizzy Cook is fabulous. I just want to encourage you to go check her out. She does have a book on the Mediterranean diet. She does have vestibular migraines. I know for the person who was asking about vertigo, that may be something for you just to go check out and take a look at her book. Also, I think it's worthwhile noting here, talking about correlation versus causation. Again, maybe this is slightly off topic, but how does someone know if a food is a trigger of an attack, or if it is just correlation in terms of in the prodrome, they're craving something, and then hours or half an hour the next day, they get a massive attack, and so they think it's triggered it. How do you determine that?
Amazing question, because that's a question we ask all the time. There's no perfect way to know. Right? So prodromally, we're going to crave things and we're going to want sweets. So chocolate, the main one, which we think is a trigger, is actually more commonly a prodrome. The way I look at food triggers is there an association in time that you're eating something and it is consistently having an attack? And if we eliminate it, are you preventing attack? A prodrome by
Right.
like, if it makes sense, like if you're going to have a migraine attack, eliminating a food shouldn't eliminate it if it's a prodromal craving for something. I mean, theoretically, when I
Right.
think about it, but I think there's a lot of times where it's helpful for the person, if they think that there is some correlation, just cut it out. Cut it out and see, and then add it back. So the thing is, you're not going to know if you cut it out. I say eliminate it for like 8 weeks, so it's clean out of your body, and then add it back at a consistent interval. If it's like one time, you're like, it's very hard to know. And it also really only works if you have pretty low frequency migraine. Because think about it, if you're having a migraine attack every other day, it's going to be
How do you know?
impossible. You can't know. So
Right.
the one I introduce like dietary elimination and triggers is once we've gotten a better sense of frequency and gotten things better under control. Otherwise, it's extremely aggravating trying to figure that out.
No, that makes total sense. And I know for myself, chocolate is definitely not a trigger, thank goodness. Neither is caffeine because I'm British. So I got to have my cup of tea. But I was inpatient at a headache center once. The shall remain nameless, where we were put in a ward where we had no access to chocolate, but unless you were very sneaky, which of course I was. But the theory at that time was, chocolate's a major trigger. But
Yeah.
we know that nothing's a trigger for everybody anyway.
Yeah.
And
Yeah.
correlation does not equal causation. So that's just something for people out there to think about. I know that we're kind of getting really short on time. We have like 15 minutes left. And I want to talk about some movement as well. But I also want to talk about children and a holistic approach to migraine. So, I'm going to skip straight to that, if that's okay. We know migraine's hereditary. So a lot of us who have migraine, we have children. I personally have 3 sons. They all have migraine, which is why I always laugh when people say it's a women's disease.
I'm convinced my sons do too. I'm convinced they
There
do
you go.
based on their motion sickness, stomach,
Right.
like upset,
Right.
100%.
Absolutely. So let's talk about a holistic approach for them, or an integrative approach. I know that for myself, when I was a child, that there were no options. But when I watched my sons going through it, 2 of them started at age 9 and 1 in adolescence, it was heartbreaking to see them put on medications that hadn't been tested on them, see horrible side effects. And I wish I had known about options there. So what would you suggest for parents of children and adolescents?
I think early identification and intervention is key. I think a lot of times, because kids are kids, right? They're just complaining. They're not. I think if you have
Right.
migraine and you're with a family like of other ones with migraine, then identifying it earlier in kids, we know are better outcomes. We know the earlier you intervene, it's a disease process. It evolves. So halting disease progression is one of the best things that we can do. So one of my favorite things to do is when I have a family and I see a mom and then she brings in her kids, or we talk about kids and they start coming in, and then we're able to intervene before things get bad. So what I always say is, we talked about before, migraine brain hates change. But what is something with kids? Things are always changing. And it might not seem like a lot, but breakfast, like there's good evidence for just having kids have breakfast. And I fought it my whole life. I still kind of do, but it could be anything. Something small with protein can set you up for a better day. And then also with kids in school, there's a lot of lack of access to, again, water might not be the end all be all, but again, keeping consistency, saying, how could I set up my kid in school for success? We want them to be having some snacks, like something every 3 to 4 hours, having water throughout the day, movement breaks, screen time, trying to diminish as much as we can, which has been harder over time. But I would say the top 3 things I would say is make sure your kid is having breakfast, make sure you're paying attention to when they're getting their migraine attack. A lot of them happen before lunch. I look at the school day, look at where that school hour is. When is their lunch? When's their dinner? Are they having an after school snack? That's where diet, I think, could be helpful, looking at the sugary content of food, trying to stop the huge sugar spikes.
Right.
Making sure that they are getting physical exercise. So exercise is protective and it's hard, but in a kid, I feel like that is something that we can do and encourage for all parts of their health. So getting some sort of physical activity most days, encourage it from a young age. And then sleep. So sleep is a huge part of the equation. And what I see a lot of is kids start having irregular sleep schedules and they have more work and they have more schoolwork and they're staying up later. And that is what sets everything in motion. That's when my kids or my patient, they go to college, right? And everything is just like derailed because of the sleep and the work. So getting your kids on a good sleep regimen, and it's hard. Trust me, I have kids. sleep, like why do kids not want to sleep? I don't understand, but
Right.
trying to ingrain good sleep habits and about set sleep and wake times. It's not, okay, every weekend we stay up late and we watch movies and yes, maybe once in a while, but changing sleep schedules on weekends versus weekdays is going to set the brain into a more inflammatory state to trigger pain. So setting up those habits early can be really helpful.
Right, absolutely. I think that's really great advice. The only couple of things I would say also is that, obviously we know that if your child has frequent migraine attacks and are disrupting their school or their homework, that can create a humongous amount of stress, which obviously is also not good for migraine. And so a lot of us, we had 504 plans for our children.
Say that.
Yep. So that can be really helpful. Great resource for you, Migraine at School. I encourage you to go check out their website, their Facebook group. They just have some amazing resources that, includes things like helping putting together a 504 plan, some potential accommodations, right?
I do it all the time. I do a ton of 504 plans. And I think the little things that are helpful, like put it in the plan. Schools have to accommodate. Right. You can bring a water bottle, you can bring a snack, you can wear, like if I write for them to wear their migraine glasses, to limit screen, like you can put that all in there, and it's extremely helpful. But waiting to do it until things get bad, I think is the problem, because we need it in place beforehand. So I always encourage, if there is migraine in the family, if there is any evidence of it, see your doctor and get that in place now. It can't hurt. It can only be helpful.
Right. Absolutely.
And also one more thing about kids is they're complaining about like frequent stomach aches or motion sickness or other childhood precursors to migraine. I think we just need to be aware that it doesn't have to be pain, and it can present very differently in kids.
Yes, absolutely. Yeah. One of my sons, it was stomach aches, as he put it, a lot of nausea, and, and it took a few years, to be quite honest, for the pain to start to come, but the stomach issues were bad enough to disrupt school. So that can be really hard, because as parents, our children often say, "Oh, mommy, I got a sore tummy," and so you're not really sure what's going on. But if there's a pattern, that's worth tracking it, right? Also, there's a couple of devices that are.
I'm going to say, devices. If you know me, I love my devices. They're part of everyone's toolbox. But I say, if you're in the age of, it's mostly like teenage, adolescent, but get a device. Like, they're easy to use. Get one. It's hard to make kids wear them. I feel like the 20 minutes, 45 minutes, but do it. It can change lives, and it's easy and simple, and it's not something you're putting in their body. And it gives them a tool. So I have some of the kids I treat who, they can take them to school. They can wear them at school. Like, we write in their 504s. They're able to proactively treat. And I find that that's so valuable also when kids know they have tools. Right. And they don't necessarily have to ask for permission to take it. It's
absolutely. Yeah, absolutely. So I encourage you, here's a resource, our own website, migrainemeanderings.com/devices. We have information about all the devices there, which ones are FDA cleared for adolescents. Encourage you to go and check them out. This is a non-medication option for your child. So why not try it? I wish these had been available when I was a child or my sons were younger. It's just an amazing resource.
I love them. Like, I have them all in the office, and I'll put one for a different tag. I have them all on my website too, and like who to choose and how to get them, because I think they're an underutilized resource and one that you should be using first line in kids.
Yes, absolutely. I believe the devices should be foundational in everybody's toolbox. Everyone should have at least one.
I do that. Everyone gets a device.
There you go. Everyone should have one. People who know me know that I'm often going around wearing the one that goes on your arm. Not going to mention the brand, but it's pretty obvious. And nobody knows that you're wearing that on your arm. It's hidden. No one knows. But it really can actually stop an attack. And of course, now it's also FDA cleared for prevention, that particular one, as is the other one that's approved for adolescents. So moving on from that, I know we're only got a few minutes left. If anybody has any other questions, please put them in. We will get to your live questions if you have them within the next 5 minutes. So let's talk about movement. We know that exercise and movement can be a double-edged sword, right? For a lot of us, I know for myself, exercise is a massive migraine trigger if my heart gets too fast, especially, or if I'm exercising outside and the sun's too bright, the wind's too strong, it's humid, or the environmental factors. But we also know that movement is important for migraine. Where is a good place to start, especially for someone who knows that exercise can be a trigger?
This is the hardest part, because when we know something's beneficial, but it hurts, why would we want to do it? So I talk about subthreshold exercise, basically getting your body to a point where it's not at that heart rate that triggers. And it's hard to sometimes know where that is, but I do talk about different heart rate zones and how to calculate that. And then saying this, I'm going to get here and then stop. And once I get there and I'm able to do it for 2 minutes, 3 minutes, then maybe I'll push my time or push it up a little bit, but not letting yourself get to the point of no return. And then training your body. And it's not running a marathon today. I had a patient actually come in the other day. It took us 8 months. 8 months to get her to the exercise program. And now she's like, it changed my life. I think of all the patients I've told her to, I said, you're like the only one who's like actually like stuck with it. But I see the results when stick with it. It's not overnight. So we had her start literally with like 2 minutes, like a day, and really gradually building up. But it's the gradual buildup. If you're going to go and do it all at once, you're going to trigger and then you're going to stop. So I would say pick an exercise you like. It could be anything. It could literally be anything, but I say something that's non-weight bearing is probably better because you're not having the pounding. So like a recumbent bike. I have like an under the desk. It's called like, has a little like elliptical, like you could just put your feet and move it. You could do elliptical, you can do rowers are good, but set your sights at starting with 5 minutes, 5 minutes, and then stop. Even if you feel okay, you just stop. And then once you're able to do that, I'd say like 4 or 5 days a week, go to 6 minutes. Or 7 minutes. So that's like an easy way to just add on time. And then that's one way to do it is time-based. You could do it heart rate based. There's different ways, but just doing something gradually. And I think that's the hardest part because again, if you just want one thing, tell me just do that one thing and then that's it. But this is a very gradual process, but it is doable. And it's again, teaching our body to not react to stimuli of the exercise of the increased heart rate is really the goal.
Yeah. So very, very challenging. And, for those of you who are overachievers, I'm very much an overachiever. So when I start doing exercise, if I feel good, I'm like, I'm just going to push it. And of course, I don't push it a little, I like jump into, oh, I can do this. And then it backfires. So just want to encourage you, slow and easy, steady. More is not necessarily better. What do you think about things like Tai Chi, yoga, those type of more gentle movements?
Yeah, there is evidence. So there is evidence for gentle movement. Doesn't only have to be cardiovascular fast movement. So yoga does have evidence as part of a combined treatment plan. And I would say taking it at your own pace. Like there's someone who does yoga for migraine, and I really like her resource because it gives different yoga to do for different types of migraine on different stages of where your pain levels are, but really being in tune with yourself, but just moving at all is helpful. So Tai Chi, it's still movement. And it's again, one movement isn't necessarily better. It's what you're able to do. So pick if it's walking, if it's Tai Chi, if it's swimming, if it's yoga, whatever it is you can do, there's benefit for all of it.
Right. Absolutely. That's really good to know. I do have one more question here. Actually, a couple more questions that came in. That I missed. So somebody asked about the app for supplements. That was drugs.com. Mm-hmm. Drugs.com has an app. So maybe if one of the moderators can put that in the comments for people, it's really helpful. A question about ragweed. Actually, it says, if you're allergic to ragweed, can you take Butterbur? Can you take Petadolax if you are allergic to ragweed? Do you know?
Actually, that might be one reason you wouldn't. Okay. But that's a really, really good question. And actually, I'd have to get back to you on that one to be 100% sure. Because even as doctors, we don't always know every single thing.
I love it when doctors say that they don't know something or they need to check on it. No one knows everything, right? So always better to say, yeah, I'm gonna go check on it. So that's an interesting question. We did have a question here about, and I'm sorry I didn't get to this before for the person who asked this, about the use of music or different sounds. For myself, I generally rarely listen to music because sound is a big trigger for me. But I know that for some people, maybe it's relaxing. There's also the tonal sounds. Maybe I'm giving that the wrong name. Is there any evidence for the use of sounds or music in preventing migraine? I can't even imagine using it to treat an attack because we like quiet. But what are your thoughts about that?
I haven't seen, I love music. I was a musician. I feel like music therapy is important. And I feel like there is therapeutic listening. There are different actually sounds and that can be helpful for a number of different conditions. For example, like tinnitus, for dizziness, but I'm not sure exactly for pain itself. And if you're looking for pain modulation, light therapy more so than sound therapy, I haven't seen any great data for sound.
Okay. It's so good to know. That may be just one of those things that's out there and people are saying it works, but
If it
more of
works,
an old wives'
wonderful.
tale.
Yeah.
But if it does work
Yeah.
for you, then great. So go for it. And the last question, this is probably more of a comment than a question. And thank you so much for being patient with me. I'm kind of like jumped all around today a little bit, but this is such a hot topic. And you covered so many different things. So, fabulous job. So somebody wrote, their experience with supplements is that they work for a bit and then they stop. Is this typical? I know that a lot of people say this about medications as well. I always describe it like, it's almost like migraine is AI, it has this artificial intelligence. It's like, something starts helping it. Haha, I got you. Yeah, this is not going to work. And then it changes. I know obviously that's just, garbage, but
I think the important point here is, what does working mean? Because I think also what happens is you start feeling better. So you expect it to start making you continue to feel better. And I think when we're looking at evidence-based supplements, I'm looking at like a 1 to 2 day a month reduction. That is a good clinical outcome. So if you've gotten that, it did work. It's just not giving you further benefit from there. And it might be part of the toolbox, but might not be all of it. And I think I always like to define, what does it mean that something has worked? And are we keeping track? Do we remember what's happened the past month? Because if we're not documenting it, how do we know? So I think the first thing is, I'm sorry, the phone is ringing in the background, to take stock of where you started and then where you've come with it. And if you've made the amount of improvement that I would expect, then it did work. You're just not getting further improvement from there.
Right. Absolutely. And also, because migraine is so complex, you could be going through a bad patch. So it may not be that it's not working, either the supplement or the medication. You could just be going, or the device. You could just be going through a bad patch.
And our brain gets sensitized. So it's also that maybe your brain at that moment, like you said, it's not that one supplement or not that one thing that is the problem. It's something else that took precedent. So I always ponder, I'm like, is it not working, or has our brain just changed?
Absolutely. That makes total sense. I know that we're at the end of our time, but before we close, is there anything that I have missed or any final words that you would like to add to this topic?
I want to first thank you. This has been really fun. I love talking all things migraine. I think we've covered a lot. My message is always that migraine is complex. It's tough because we suffer so much inside and no one can see, but I want everyone to know you are seen, like you are heard, and there are resources out there, and to utilize them, because I think we all get scared in our own brains and it's like, I can handle this, right? I'm strong enough. I don't need it. We can all use those resources and help each other to get better.
Absolutely. Absolutely. I appreciate that. Thank you so much for being with us today on Migraine Meanderings. Dr. Natbony, really appreciate you. Thank you for everybody who's attended today and everybody who's going to be watching this video afterwards. If you have any questions or comments that have not been answered, please let us know. We know that migraine is an incredibly challenging and complex disease to live with. You really are not alone. Please check out Dr. Natbony's website. Check out our website as well. We have a lot of resources. We're on all the social media challenges, all the social media channels. Losing my voice there and brain, I guess. But we also encourage you to proactively partner with your doctors. Talk to them. Be a self-advocate for yourself. Don't always think that your doctor knows everything, because they don't. It is your body, your healthcare. So talk to them about what is important to you and what is going on, and create an action plan, a holistic action plan to help manage this disease better. So again, thank you for being here today, everybody. And again, Dr. Natbony, thank you so much for joining us.